How's everyone doing? My name is Gresham, and I'm excited to present to you guys my critically appraised topic, which is the role of compression garments in preventing musculoskeletal strains in Division I basketball athletes. This research pretty much explores whether compression garments, which is the commonly used recovery tool, can help mitigate musculoskeletal injuries in this high-demand athletic population. So let's get into it. As far as the outline for the presentation, first I'll be taking you guys through the introduction as well as the focused clinical question that we're going to be unpacking. We're going to get into the search strategy of how we got our three articles, and then we're going to do an overview of those three studied articles. We'll get into the clinical bottom line and then finish up with the implications for future practice, education, and future research. So as far as the introduction, Division I basketball players often face recurring musculoskeletal strains, particularly within the hamstrings and quadriceps. These injuries are commonly caused by accumulative of fatigue, inadequate recovery, or even biomechanical inefficiencies during high-intensity activities. Traditional injury prevention strategies such as strength training, neuromuscular exercise, or even load management are effective, but don't fully address they may not always address the full scope of injury risk. Compression garments have been proposed as an additional tool, offering benefits for enhanced circulation and generalized improved recovery. The objective of this research is to determine whether compression garments directly or indirectly prevent musculoskeletal strains in Division I basketball athletes during the competitive season. As far as our focused clinical question, I'll start with a general scenario, which we have a 22-year-old male Division I basketball player who's been experiencing recurring hamstring strains during the competitive season. Despite the structured strength conditioning program, he continues to report muscle fatigue, tightness, and discomfort after high-intensity practice and games. So with that, for our focused clinical question, the question is, can wearing compressive garments reduce the incidence of musculoskeletal strains and soft tissue injuries in Division I basketball players during the competitive season compared to not wearing them? Just for generalized context, the competitive season is the period of regular practices and games and tournaments with heightened physical demands and very limited recovery time. So you're thinking about the general regular season during different sports. This is when athletes are most vulnerable to fatigue-related injuries, making it an ideal time to evaluate the effectiveness of compressive garments in preventing musculoskeletal strains. Getting into our search strategy, as for the database, we use PubMed with the following search terms below. For our generalized results, we came up with a total of 50 total studies identified, and 3 of those studies were selected after go through the exclusion and inclusion criteria, which we have right here. Inclusion criteria being published in the last 10 years, randomized controlled trials or cohort studies focused on recovery and or injury prevention. We have athletic populations, specifically basketball or similar biomechanically related sports. And we have our exclusion criteria, which is we excluded systematic reviews or meta-analysis, and we also excluded articles that sole focus on performance enhancement without necessarily addressing injury-related outcomes. Getting into our general overview of the studies, we have our first study, which is a study that focused on 30 basketball players, which ages between 18 to 22, with no prior musculoskeletal injuries, which is something that was added. The participants wore compressive garments during recovery, and the outcomes measured included perceived recovery scores, muscle soreness, and fatigue levels. The results pretty much showed that compression garments improved recovery by 15% compared to their controls, with significant reductions in soreness and fatigue. However, there was no direct link to injury prevention that was observed. The study is rated as level 2 evidence because it used a cohort design rather than a randomized control trial. While the study provides correlational data, it lacks the rigor to establish causation. On the Strobe checklist, the study scored 20 out of 22. Some points were lost due to limited reporting on participant attrition and potential biases, which could affect the overall findings. Despite these limitations, the study highlights the recovery benefits of compression garments. Getting into our second study, we have a randomized controlled trial involving 25 simulated basketball players aging between the ages of 18 and 25 performing basketball-specific drills. The outcomes measured included recovery time, muscle soreness using a visual analog scale, also known as VAS, and fatigue levels. The study found significant results recovery, being that recovery times were 25% faster, muscle soreness was reduced by 3.2 compared to 6.1 on the VAS scale. Fatigue levels were 20% lower in the compression garment group, while these findings suggest an indirect benefit for injury prevention through better recovery, uh, the study didn't measure injury incidents directly. The study is rated as a level 1 evidence due to it being a randomized controlled trial design, which is a high level of um, evidence. And the strobe checklist scored a 21 out of 22. It lost 1 point due to the relatively small sampling size, which could cause some limitations and bias. Nevertheless, the study strongly supports the use of compression garments for enhanced recovery in basketball players. Getting into our third and final study, we have a study that looked at 40 athletes from various sports, aging between the ages of 18 and 30, um, and they also engaged in high intensity training. The outcomes included inflammatory markers, circulatory recovery, and recovery time post exercise. The results showed a reduction in inflammatory markers by 18%, improved circulation by 12%, and a 20% reduction in recovery time compared to the controls. These physiological benefits highlight the potential for enhanced recovery, but don't, again, this is another article that's not directly addressing injury prevention. So this study's rated as level 1 evidence due to it being a randomized controlled trial. However, it did score slightly lower on the strobe checklist with a score of 19 out of 22. Some points were lost for lacking specificity in the athlete population and also failing to address certain variables, which may reduce the clarity of its findings. Again, despite these limitations, the study highly emphasizes the physiological recovery benefits of compression garments, providing indirect evidence for their role in mitigating injury risks. Getting into our clinical bottom line, in summary, compression garments are effective in enhancing recovery by reducing muscle soreness, fatigue, and inflammation. These recovery benefits indirectly lower the risk of fatigue-related injuries by helping athletes maintain biomechanical efficiency during repetitive high-intensity movements. However, like we kind of discussed before, none of the studies directly measured injury incidents, pretty much limiting the ability to establish a direct link between compression garments and injury prevention, which is what we're ultimately looking at. The strongest evidence comes from the last two articles we talked about, which demonstrate significant recovery improvements through faster recovery times, reduced soreness, and decreased inflammatory markers, which can overall decrease the risk of strains in the long run. Based on the indirect nature of the evidence, the strength of recommendation is a level C, just again reflecting back on the consistent findings across the three studies. But again, that lack of direct injury prevention data doesn't allow us to put it higher than a strength of recommendation level C. Compression garments should be viewed as a supplementary tool within broader injury prevention strategies. So as far as our implementations for future clinical practice, kind of like we said, compression garments should be incorporated into recovery protocols for athletes prone to fatigue-related injuries. To maximize their effectiveness, they should be combined with other interventions such as neuromuscular training, load management, and individual strength programs. Getting into future education, clinicians and coaches need to target education on the recovery focused benefits of compression garments and their limitations in direct injury prevention. Athlete workshops can help foster better understanding of physiological benefits of compression wear within its comprehensive injury prevention plan. And as far as future research, there's a need for sport-specific randomized controlled trials focusing on injury incidents in basketball athletes. Future studies should also look to explore long-term effects of compression garments on injury risk, as well as the optimal wear duration and garment design for maximal recovery and injury prevention benefits. My references are listed down below, and thank you all for listening.